All right. So this patient presented with a wound around the rectum. So what we basically have here, when we start to trace from the anal canal upward into rectum, we see there is a lot of hypodensity around it and fat standing around it, and it is also involving this gluteus muscles on the right side, and there is a focal air foci inside them suggestive of an abscess. And when you go upwards, it is actually also involving this prostate, which is appearing more hypointense there, like hypodense. And I'm sorry about that, hypointense you mentioned when you are reporting MR and stuff. Okay, so let me just continue on. All right, okay. I was just playing with the contrast to make you sure that there is indeed can actually, yeah. So you can see there's uh, mean value is around 18, so that's hypo dense thing around the prostate. So that's also suggestive of prostatic abscess, which is happening likely because this perirectal uh, lesion, which is likely abscess, is involving the prostate, so causing a prostatic abscess as well. Then on the right side, it is actually involving, if you see the levator ana muscle, uh, one of the muscle which causes the pelvic floor, and so it's also involving that. And posteriorly it is involving the gluteus muscle, which we have already talked about. Then in midline and posteriorly it is involving the presacral region. And when you go up, you can see some of that part is going along sigmoid. However, it doesn't extend up. There is no obstruction of large ball or a small ball which is happening here. uh, you can see there is some uh, this is a small ball loop again. There is one lymph node which I see here, which is not having that much bigger size, right here, uh, which is measuring around, if I would have to guess, around 5 mm. Okay, I was wrong. It's measuring around 9 mm. So that's a significant further mesenchymal lymph node, which could be because of infection, I mind you. And there is a lot of stranding there around mesentery, which again would stand for inflammation and going on because of this abscess. What else I can tell you about this is like this prostate involvement is likely causing this patient urinary tract symptoms, especially obstruction, outlet obstruction to the urinary bladder, which has likely led to them putting a Foley's catheter inside so that obstruction could be relieved. At the same time, you can see some calcific foci inside the bladder, and the bladder wall is thickened as well. So maybe this obstruction was chronic. So we don't know about that, whether how long the abscess has been there, and has that caused any changes in the urinary bladder. Let me try to get you exact what's going happening in the urinary bladder by changing yeah the HU value, not HU, like changing my window. What am I saying? I'm just going crazy around here. All right, so here you see. Okay, so there is actually a thickening of urinary bladder going on, and you see the wall of that bladder is having this calcification going on there. So yeah, also on the left lateral side as well. Yeah, probably because of the abscess which is causing obstruction and that sort of thing. All right, so that was this case. Thank you for your attention, and whenever you are reporting abscess, you need to tell extent A, you need to tell B, complication, whether it is involving other organs and stuff like that, and what is it that will require urgent attention. Any abscess would require drainage, either immediately or electively, and looking at this case, this would require urgent drainage because it is causing urinary outlet obstruction and all. So that's it. Thank you for your attention. Bye bye. Take care.